I will explain my obsession with the term minimal access surgery. It is of course known as minimally invasive surgery, which in my view is semantically mostly correct. Because to invade is absolute. You either invade or you don't invade. And the object of the technology is to reduce the traumatic insults to the patient. Therefore, the appropriate scientific term, I wanted to get that off my chest. And has asked me to cover the potential and risks of nanomedicine, which I shall attempt to cover very briefly this morning. Firstly, after considerable debate, it is now agreed in the nanotechnology, nanoscience field that we're referring to structures or materials that by definition are less than 100 nanometers, which means we are in the molecular range. And these can be unidimensional. And these are basically very thin pastes, or paints, I should say. And there's tremendous interest in relation to hospital practice with these nano paints, because some of them, particularly zinc oxide and silver nanoparticles, are the most effective antibacterial agent. Nothing can grow on them. No biofilms can form. And it is considered that these nano paints will probably make very considerable inroads in the management of the big problems in hospital practice of antibiotic-resistant organisms. And I think we shall see very significant evidence from this. Then we have two-dimensional nanostructures. These are the nanowires, nanotubes, and bucky tubes, and buckyballs, I should say. And then we have the three-dimensional, which are essentially the nanoparticles. Now, the big issue, and I want to cover this, is why is it that materials behave so differently in the nanoscale? Firstly, there is no longer the effect of gravity. And nanomaterials have a relatively large surface area when compared to the bulk material. And for this reason, amongst others, they are more chemically reactive. Indeed, some materials are only chemically reactive in the nanoscale. And the nanoscale affects other important properties of materials, including chemical, physical, and electrical. And the quantum effect begins to dominate the behavior of these materials, particularly affecting their optical, electrical, and magnetic properties. So there is a good physical, sound physical basis for the importance of these materials in terms of many activities, not just nanomedicine. The EU technology platform for nanomedicine, the document was issued, I think, about 4 years ago. And this is the sort of opening paragraph. The definition of nanomedicine is for the purpose of this document is that nanomedicine is defined as the application of nanotechnology to achieve breakthroughs in healthcare. It exploits the improved and often novel physical, chemical, and biological properties of these materials, and nanomedicine has the potential to enable early detection, prevention, and essentially improved treatment and follow-up of a number of the disorders which are currently not treatable or inadequately treated by modern therapeutic efforts. irrespective of their nature. The first issue that I need to cover is the question of nanotoxicity and nanosafety. And I have to say that there is considerable confusion and uncertainty both in the scientific and in the public domains. And this is largely contributed, in my opinion, to very poor scientific publications in the literature, with lack of characterization of nanomaterial studies. If you want, for example, to study the toxicity of nanomaterials, you have in the first instance to document what you study. That such nanoparticle or nanotube is toxic. Unless you characterize it by the appropriate image, you don't know what to do with it. And if you take all the publications on nanotoxicity and nanosafety, cell biological largely, 40% do not characterize what they're testing. And I think this is the crucial issue that needs to be addressed. The other thing that my group in Pisa, headed by Dr. Li-Jun Wang, who is here, very often the cell toxicity assays used are inappropriate in the sense that the chromogen, the color substance they use, actually interacts with the nanomaterial. So you get spurious readings. So this is very important and has led the EU to the formation of a nanosafety platform. And this is a group of experts, both medical and technological, to outline the requirements for proper studies to assess nanosafety and nanotechnology. And from this has emerged the concept of medical grade nanomaterials. In medicine, if we use, for example, a hip joint replacement or whatever, pins or whatever, we have to have medical grade materials. And the same should apply to all nanomaterials used for biomedicine. And I think from this decision, I think, will certainly improve matters. The other consideration that in the early stages of nanotechnology, they used what is known as the top-down process, where they started with bulk material and gradually fragmented it down and down till they reached the nanoscale. That top-down is no longer used now. And it's the bottom-up. In other words, nanomaterials are by and large synthesized or manufactured, usually by various techniques, but most commonly by chemical vapor deposition. And therefore the concept, public concept, that all of a sudden the air is going to be polluted with this dust of nasty nanomaterials, which we will all inhale, whether we like it or not, and develop nasty lung conditions, in my opinion, no longer protects. And nanosafety issues only affects metallic and graphene-based materials. It does not apply to biological polymeric nanomaterials, dendrimers and liposomes. And as I will show you at the end of my talk, there are in actual usage in clinical trials drug delivery systems which are being tested for cancer with considerable advantage using, for example, dendrimers and liposomes. So we have to be careful by saying nanomaterials are toxic. It has to be. And I think that's a very important message to underline. These are the disorders identified by the document in nanotechnology for medicine in the EU. And as I indicated yesterday, these are the disorders where it is predicted that nanomedicine will make significant inroads. And this is an oncological meeting. I thought I'd stress the importance in cancer. And I'll give some examples. But equally important, I think, is the role of nanomedicine in neurodegenerative disorders, particularly Parkinson's disease. This is a disease that causes increasing rigidity and tremor and incapacitates the patient and is increasingly prevalent everywhere, but particularly in the UK. What about the potential? I've listed here the important ones because there are others. Molecular imaging, sensing, drug delivery system probably is the biggest area for significant contribution, particularly in cancer. Electropermeabilization for drug and gene therapy, avoiding the use of viral vectors. Antibiotic resistance and antibacterial therapy space. The development of anti-tumor vaccines, regenerative cell therapy, I'll give you some examples of this. Nanohyperthermic ablation of tumor, causing great interest. This is where gold nanoparticles are used, particularly. And as they're taken up by the cell following irradiation, the plasma effect was considerable endogenous heating, which can be done. And wireless electrostimulation therapy for neurodegenerative disease, cardiac pacing and arrhythmia, and skeletal and visceral myopathy. So the predicted potential is undoubtedly immense. These are the sort of properties of carbon nanotubes which have been exploited in the biomedical field. The electrical properties for motion, translation, and rotation, magnetic properties, optical properties, field emission, drug transporting, molecular detection, cell lysis, destruction, etc. And it is one area that is in the medical nanotechnology most investigated. Problem with carbon nanotubes in particular, and these are essentially graphene sheets which are rolled as tubes, either as a single tube, single wall carbon nanotubes, or as multiple concentric tubes. In point of fact, for medical applications, the single tubes are useless because they break so easily and they are imperfect. So in essence, we use, for biomedical application, multi-wall carbon nanotubes. The problem is, of course, is untreated as they occur, they bundle because of the van der Waals forces, etc. And of course, they are, for this reason, insoluble, which means they are useless for biomedical application. But this problem has been resolved by a number of surfactant polymers which allow dispersion, as shown here, of these carbon nanotubes in solution. And it is this essential step, I think, that has opened the path to the potential use of carbon nanotubes for biomedical application. And the first people was my group in Pisa to develop technologies or techniques, I should say, for the dispersion, aqueous dispersion of carbon nanotubes. In essence, multi-walled carbon nanotubes are essentially metallic. There's a lot of ifs and buts to this statement, and I don't have the time to go into it, but they are, in general speaking, metallic. And they are used in preference to single-wall carbon nanotubes because they are more stable and less likely to fracture when administered in animals or humans, for that matter. Carbon nanotubes can act as nanosensors because of the change in the electrical conductance resulting from the absorption of a biomolecule or protein. And this can be exploited and amplified in various ways and has been done so. So a lot of very significant developments in nanobiosensors based on nanowires and carbon nanotubes, including nanoscale cantilevers for cancer-related detection of cancer-related molecules. And these will be part of the microfluidic chips that will come on stream fairly soon, I think. These are images of a carbon nanotube built for us by a company that we work. The scale is 10. This is a multi-wall carbon nanotube. You will see that the tip is slightly bulbous here. And then this is because there is a metal impurity, largely iron. And it is this that renders or partly is the reason, not completely, that carbon nanotubes are paramagnetic and therefore can be influenced by magnetic fields. What makes a multi-wall carbon nanotube biocompatible? And this is the work we have done in Pisa and also at IMSA, in Dr. Wang's lab. High degree of purity, at least 97–98%, and you have to confirm this by scan. Have to have low amorphous carbon content. Again, you have to quality control this to less than 1%. Preferably less than 3% metal impurities. The higher the metal impurity, the more toxic it becomes. The length is very important. In my opinion, for biomedical application, no carbon nanotube should be longer than 1.5 micron. Whereas experiments show you that if you have long carbon nanotubes, certainly greater than 10 microns, they behave like asbestos fibers. And in animals, they cause granulomas similar to asbestos. And this is thought to be the result of what is known as prostrated phagocytosis. And I think this is important. Ideally, the end of the tube should be closed, and I'll come back to this, for the realization of certain properties of the nanomaterial. They have very important field emission properties. When placed in an electric field, they strongly enhance the electric fields at their ends. And this effect is responsible for the observed threshold I've shown here of less than 10 to the 4 volts per centimeter for the electric field emission from a carbon nanotube. Indeed, the field emission properties can vary greatly, both between single and multiple carbon nanotubes depending on their structure, and in particular their tip structure. The tip structure ideally has to be closed and well ordered. And the large field application is due to the small radius of curvature of the nanotube tips. This is an example, again, from a study in Pisa. This is a big cell, which is used very often in nano study. And as a result of electropermeabilization by carbon nanotubes, we were able, as you can see, to load it with a large amount of gold nanoparticles. CNTs can also enhance electromagnetic fields, provided certain dimensions are observed. That the carbon dioxide is at least 1 micron long and 100 nanometers thick, in which case the electric field at the tips will be enhanced 35-fold. Which means that for electroporation of tumors and tissues, you need only very low voltages. And this has important practical applications. And on the basis of this, the cell and tissue electroporation for drug and gene therapy has been demonstrated by the Pisa group and others using orthogonal electrical fields. And because when cells are placed in contact with these carbon nanotubes, provided the carbon nanotubes are small enough, they actually enter the cell without requiring any energy. If they're big, they do. And this combination of cell and close proximity to carbon nanotubes enables the use of very small voltages for effective electroporation. This is another important observation made by Virginia Pensavena in Italy. That carbon nanotubes, once they stick or penetrate cells, make the cells responsive to magnetic fields, which means you can shepherd cells. And this is of great importance in regenerative medicine. So the cell carbon nanotube combination move towards an electric field. And this is a very important experiment which has been published, which we did in Pisa. And there is Pisa is a regional center for pancreas cancer for the south of Italy. And they get about 250 new pancreatic cancers a year. And there's a big research program for the development of islet cells from stem cells. The problem with stem cell therapy is when you inject it, they don't stay where you inject them, they disseminate everywhere. They don't stay long enough to form a colony, to form a tissue. And this is an experiment where we injected into the liver these derived islet cells from mesenchymal cell cells into the liver, except that the rat had a magnet over the liver. And within 3 or 4 weeks, there were islets of these mesenchymal cells in the liver as a result of this magnetic field effect in keeping the cells long enough for them to establish a common colony. Whereas in the control experiments, as you can see, there was those cells detected at the site of injection. It is also possible, by the use of carbon nanotubes, to set up a system of wireless cell permeabilization for gene and drug uptake. And this was the basis of the Nineveh project, founded by Rainbow 6, which is now completed. And basically this created a virus which had the right ligands and carried the genes, particularly for patients with stroke. The neurologist concerned indicated to the group that when a patient has a stroke, the center of the lesion is dead, but around the infarct, the dead area, is a penumbra of cells which are not dead but could survive. And he developed an anti-apoptotic gene for the cells, which would prevent or encourage the cells that are just about living to recover. And the idea was to, for stroke patients, develop this virus, synthetic virus, which would transfect, as it were, this area and transfect the necessary genes for the recovery of the cells around the infarct. And this is the basis of the Nino. It's a long film, but we will show a bit of this. This is the Nineveh. This was shown to the EU at the end of the project. So basically we have these what I call viruses really, and injected by suitable stereotactic into the lesion, obviously. And the idea is because if you made them in the right size, these nanotubes will move very effectively in the tissue fluid of the brain. And diffusion is the first Brownian movement. This was confirmed previously. And the idea of this tube, that these would travel to the neurons, as they did, as I'll show you some studies subsequently. And because they have ligands, they carry their payloads of genes, they will latch on to the receptors of the cells, so this is targeted gene therapy, or would be. So it will seek the cell surface receptors through molecular recognition, as shown here.